least 11 patients in the intensive care unit of Tirupati's Ruia Hospital last evening have died following a disruption of oxygen supply. The videos have emerged that show a mad scramble inside the wards as medical and paramedics as well as others are trying to revive and keep patients alive in the moment of a crisis. The attenders of the patients allege that there was disruption as far as the supply is concerned for about 45 minutes, whereas the district collector has gone on to say that the supply was stopped only for 5 minutes and was resumed, but the hospital has lost about 11 lives as of yesterday. Now we have connected bulk cylinders and there's no reason for worry, is what he went on to say. A major disaster was averted because of quick action by medical staff. This is what the collector Hari Narayan had to say. He said that the delay in the arrival of oxygen tankers from Tamil Nadu had triggered the crisis, and he also went on to say that the hospital had 1,000 beds, of which 700 are oxygen beds, and 30 doctors were attending to those patients. The Chief Minister has ordered an inquiry into the matter. My colleague Uma Sudhir brings us more.
Extremely disturbing and distressing visuals coming in from the ICU wards of SVR Ruia Hospital in Tirupati, Andhra Pradesh, where in fact there was a disruption in the oxygen supply causing distress among the patients and also panic. 11 people have died who were all COVID patients, and we are being told they were on ventilators or on oxygen support, and they have died because of the kind of disruption that happened. As we can see in the visuals, the patients, the attenders, as well as the paramedical staff and the doctors, in fact, in a sense of panic and trying to revive whichever patients they can for who they see hope. And the district collector who came in later, Hari Narayanan, he has confirmed that 11 deaths have happened, and he said that the distress happened for about 5 minutes, even though the patients and their attendants are in fact claiming that the disruption happened for over 25 minutes, some of them saying as many as 40 or 45 minutes that oxygen supply was disrupted. What we understand is that there is a 10,000 litre oxygen tank at the hospital, and this oxygen tank had almost run out. There was a delay in the tanker coming in from Siri Perambudur. That's what district collector has said, and they were trying to shift these patients, all the patients who were in the ICU or on oxygen support, to bulk kind of cylinders. But during that process, there was a dip in the oxygen pressure, and that is what is supposed to have caused this disruption in supply. So what kind of effect it has had on the other patients in the ICU who have survived this ordeal, that is not yet clear. But the Chief Minister has now ordered an inquiry to find out what exactly went wrong. They would like to ensure supplies, of course, adequately to all the hospitals in the state. What we understand is that there are at least 35,000 patients, COVID patients in hospital who require oxygen as of now. And one of the reasons why the partial lockdown was imposed in Andhra Pradesh is also because the health infrastructure is totally stretched, and the advisors to the Chief Minister had told him that further load cannot be taken by the system, and therefore it is best to try and take measures which would break the virus chain and therefore bring lesser number of people to the hospital in a critical kind of a state. So this kind of shortages and stretching of the system, that's something that every hospital perhaps is experiencing, because on social media, and we are also getting primarily calls from people asking for help in getting ICUs or oxygen beds. That is something that the district administrations and the government says is adequately taken care of with the kind of facilities that they have created in the last 1 year. But that is something perhaps common to all the states across the country. But yes, Andhra Pradesh has a partial lockdown in order to try and cope with these numbers. Between 12 noon and 6 a.m. there is a lockdown, and between 6 a.m. and 12 noon essential services are open. In the neighboring state of Telangana, you don't have any lockdowns at all. There is a night curfew between 9 p.m. and 6 a.m. And even in Telangana, the systems are quite stretched, at least even though the government is claiming that there are adequate oxygen beds, ventilators, medicines and hospital beds available. But what we see on the ground is there is, of course, a stretch on the resources itself. We had visited, in fact, King Koti Hospital, which is a major district hospital in Hyderabad, where on Sunday a disruption in oxygen supply was experienced for about 2 hours. The report suggested that there could have been as many as 3 to 7 deaths that happened because of the disruption in oxygen supply. The health authorities have denied that and said that no deaths occurred due to that. We visited this hospital and got a first-person account from the attendants of the patients who say the patients were all struggling and they in fact had to make arrangements, private arrangements for oxygen cylinders.